What is menopause? So menopause by definition is when a woman has had no periods for a consecutive time of 12 months. That is menopause. So it's essentially a day in time. It's not the most useful diagnosis because, of course, as you know, they get symptoms for a long time beforehand. But menopause is defined as having had no periods for 12 months, and that's you're menopausal. And then after that, you're permanently menopausal. So you're post-menopausal, we call it, but you're essentially always in menopause. So perimenopause is literally the period running up to menopause. Okay, so the time up to menopause, and that can last anything up to 10 years. So the average duration of sort of perimenopausal symptoms is 7 to 8 years in women. So if you imagine the average age of menopause in the UK is 45 to 55 years. Average age 51. So if you imagine if you're getting symptoms for up to 10 years beforehand, and those symptoms can start in your late 30s. So from the late 30s onwards, women can start to have symptoms. They're just generally not aware of them. So a lot of them, it's myth busting and giving them correct information and saying, look, these are the facts. So what I think my job is to give women facts. I would not recommend anyone to do anything, but I'll give them facts and say, look, these are the facts for you. Okay, so not the facts for everybody, the whole population. These are the facts for you. This is how it applies to you with your personal history, your family history, you know, what's important to you. So I'll say to every woman, you know, what's important for you in your life, you know, what do you want to be achieving and what do you want to be trying to do? And on the basis of those things that they've told me, then I'll say, right, okay, this is what I suggest. And we'll go through all the lifestyle things to begin with. And then we'll talk about options for medication and give them facts as they apply to them. So it's a bit more specific to the individual so that they can think, right, okay, so that's the general rules about HRT and the benefits, risks, side effects, etc. But this is how it applies to me. And then that enables them to make an informed choice whether they want to do it or not. And I'll support them with whatever decision they make. You'll know all about your own autonomy and justice and all the ethics. So, even if a woman can say, if I think that's bonkers, if an informed woman who has capacity makes a choice to go down whatever route, then I'll support her to do that. So you probably know your hormones do this, in the perimenopause, they don't kind of do a steady decline, your estrogen ups, down, up, down, up, down, up, down. So they can have good days and bad days. So there's a real psychological journey to go with women as well, because there's a real element of self-doubt. So they think, well, it can't be my hormones because I was good yesterday and I'm rubbish today. So it must be something I'm doing. There's a real negative ownership of it, if you understand that. So it's all like, it must be me, it must be something I'm doing wrong, because it can't be my hormones, because my friend's okay and I was okay last week. And so there's a big lag period, I think, before women do seek help. They're usually quite forthright about the physical symptoms, the hot flushes and night sweats, but not everyone gets those. Palpitations, joint aches, headaches, etc. They're always, and I think this is a societal issue with mental health problems, they're always a bit more reticent to talk about the mental health issues with it, the low mood, the anxiety, the irritability, the rage, the poor concentration, the low libido, all of those things. They're always a bit more reluctant, so they need a little bit of prompting sometimes to talk about that. I'll say, well, lots of women report that their mood's a lot lower, and if you notice that, but most of them will be aware, even if they've not had a past history of mental health problems, most of them will be aware of the fact that they're not depressed, they don't feel depressed, they've still got motivation. It's just there's a lack of enjoyment sometimes, and it comes and goes. It's not that pervasive low mood that you get with depression. It comes and goes because you can still go out and have a nice time with their friends, and sometimes, but they're just kind of lost their kind of the joy of life, really. It's not they do things, but it's just not quite as joyful as it used to be. And once you start, and then absolutely taboo, so kind of take them on a journey with it, with how they're comfortable, and then the absolutely taboo things that you really have to, which I do in every consultation: genital urinary symptoms, so the vaginal dryness, the pain on intercourse, running to the toilet, going to pass urine more often. They're the kind of once we've really warmed into the consultation, I'll start on those, because they don't want we don't talk about that. just don't talk about that. I mean, would you have a conversation with your pal about a dry vagina down the pub? So they need a bit of encouragement sometimes to talk about that. But it's really common, and as you probably know, once they've got those symptoms, they don't go away. So it's not like, so a lot of the other symptoms, the hot flushes, night sweats, palpitations, etc., will often settle once you kind of get established in your menopause. But those vaginal dryness symptoms, they just carry on if they're not treated.